Before we run through hip mobility, it's important to get an objective sense of what's going on. Is there room for improvement? Is there a significant difference from right to left? So our basic assessment of hip flexion is you would just lie down and you're just going to pull your knee in towards your chest. And what we're looking for is, can we comfortably bring the knee to the chest and get our thigh to our ribs? Or is it stopping quite short of there? Obviously if you're feeling the pain that you've been suffering from on the way to this, then we're thinking that we want to work on the hip flexion, we want to work on the hips as well if you're having low back pain. And this is important to check as well if you have knee issues, even ankle issues, is are we able to get good hip flexion? So the other leg should be relaxed, it should be on the table, it shouldn't be lifting, and we should be comfortably getting our thigh to our ribs here, so there shouldn't really be any space between there. Another thing to look out for is as you bring the knee forward, does it tend to just kind of want to roll out? What we're thinking, if that's the case, if you can't bring it straight up and you have to bring it slightly out to really get the thigh to the ribs, then we're thinking that there's likely around the piriformis muscle deep in the hip maybe is quite shortened and perhaps hypertonic, and it's not willing to lengthen. Another thing, that if you find pinching in the front of the hip, it's often because of the back of the hip capsule isn't lengthening properly. So we definitely want to target that through the 90-90 stretch in the mobility section. So as usual, you're going to check both sides, see is there a major difference from one side to the other, see if this movement elicits the pain that you're suffering from, and you want to look at this if you have hip issues, knee issues, ankle issues and low back issues. If you don't have those issues, check it for shoulder issues as well, neck issues. Obviously we want to start to piece things together and see what way the body is compensating to cope with the issue.